Dr. Jones, are you doing sedation dentistry in your office?
Absolutely. You know, there are people, Helmut, that just have such a fear built up about going to the dentist that they just avoid coming altogether. And so we offer sedation for those people so they can be totally comfortable, whether it's completely being asleep or another level of sedation. We want our patients to be totally comfortable when they have their dentistry done. After all, they know inside that they need to have this done, but the fear has gripped them so badly that they cannot bring themselves to have the dentistry done that they need. And sedation has been the answer for many people to get their dentistry done while they're sleeping or while they're sedated, so that they don't have those concerns, they don't have those fears while the dentistry is being done in their mouth. And when they wake up, often they forget they were even here at the dental office, which is kind of a good side effect. But the dentistry is done. They no longer have to worry about, oh, I'm going to the dentist tomorrow, I'm going to have this done. They don't have to worry about that because they've been made completely comfortable, and their mind has been put at ease, and they have not had to suffer through mentally what they've pictured in their mind is going to be a bad experience. And they've not had to go through that. They've been completely comfortable, made comfortable by the medicine that we now can use to make that happen for them in their life.
Right. So let me ask you. So you said a couple times kind of they sleep, but they really don't sleep because you actually talk to them. You say, move your mouth to this, and you feeling comfortable. Right? They actually answer you. If a person, people with this sedation dentistry, you can sometimes, actually all the time, you can do lots of work in one shot. So they might actually want to go to the bathroom throughout this operation, and they can tell you right?
Yes, absolutely. In fact, many times we just ask them, how are you doing? And they just kind of they're so relaxed, and they kind of look up and say, I'm doing great. And then we just continue working, and you're absolutely right. They need to go to the restroom. We can help them to the restroom. And many times it's because they have a need for multiple restorations or multiple things they need to have done at one time, and they don't want to go to the dentist in the first place. That's why they're being sedated, and that's why they've chosen us, is because we do that for them.
Right. So it looks to me like, from what you say, there's obviously the people, the dental cowards or whatever. Anyway, the dental phobics, and there's especially in dentistry. I'm sure there's other fields also, but especially in dentistry, there are so many what I think is hangovers from the old time, where a root canal is the worst thing in the world. And the truth is, I had one about 5 years ago. The fact, here's what the only thing which annoyed me about the root canal. Or for that much, the exact same thing annoys me about a cleaning. 40 minutes in that dental chair, and that is, you are counting sheeps. What are you doing there? So it's like, and you need to open your mouth, so you have attention on it, and all that. So it's really just being bored, which annoyed me. But anyway, people think dentistry is bad, so the ones who are afraid of it, this is wonderful. But looks to me that this is also good for the guy who says, look, I need 9 dental visits, and they're going to do this here, this here, this here. Well, is there any way for me to kind of like check into the dental office at 9 in the morning, get out at 4 in the afternoon, and have it all done? And it looks like only sedation dentistry can provide that, because otherwise there is no way you can cut a guy and have him with you for that long. Is that correct? So it would be good for the business guy, or never mind the business guy, the housewife who has a hard time breaking loose for 2 hours for 5-6 times. So she may as well just break loose one time a whole day. It's easier to get a babysitter and everything for one day than like 5 times every afternoon, driving, traveling, name it, whatever, right?
Yes. Yeah. And many people choose that, Helmut. We offer that to everybody. When they say, well, how long will this take? And I usually offer them. I say, we can do this all in one day, or you can do a little bit of time over a few months. So that is a choice that we offer every time we see somebody. And you know how we strive, whether somebody's sedated or not, we strive to make them as comfortable as they can. But you and I both know that it's not the most comfortable place in the world to be in a dental chair, even though we're doing everything we can. And so some people choose sedation because of that fact. They want to get it all done, but they don't want to go through the hassle of okay, I have to have my jaw open, I have to listen to all of this, I have to go through that. And so they choose sedation just for that fact. It's proven to be safe. It's something that we specialize in, and it's something that a lot of people have chosen just for that main reason, so they can just be as comfortable as possible, not worry about it all. And when they're done, they're done. They don't have to worry about coming back next week or next month.
I think that's a big factor. I mean, me personally, and I'm sure there's a lots of those, people out there. I would rather, even though it's boring to sit there for 30 minutes, I would rather say, can you do 6 cleaning in one time and I'm done for 3 years? You know what I mean? I would rather do that. I would rather
won't work. Won't work.
I know it won't work. I would rather get 4 haircuts in, because once I'm sitting there, okay, let's get it over with, type of thing. So that's wonderful. Now, are there any side effects, Dr. Jones? I mean, and I'm not talking the side effect that probably you need a driver to drive you home because you're a little bit out there, I guess. I'm not talking about that. I'm just saying, is there something, if we're talking somewhat on anesthesia, we're talking, is it a dangerous thing?
No, it's not dangerous. At the levels that we use, we monitor our patients. We've got hospital-grade monitors that we make sure that everything's fine. And the side effects, as far as chemically, these chemicals are processed in our bodies really quickly, within just a few hours. And so when our appointment is done, we make sure you're totally awake, you're totally there. To my knowledge, there are no side effects. Now, there are side effects if you're taking medications, and so a very careful medical history is taken before we even start you on any medication that will sedate you, because we want to make sure that we are as safe as possible. And if it's necessary, we have other means that we can offer you the dentistry that you need. But the most important thing is that it's your own body, and we want to do the best for you. We want to weigh all the risks and benefits. And if the benefit for you is to be sedated and get it all done at once, that's what we want to offer you. But, if you're taking a medication that interacts with the medication that we're using, of course, we're not going to do that, because your ultimate safety is far more important than a quick dental visit, or a complete dental visit, I should say, where you're sedated and you get all your work done. So it's a thorough examination that allows us to make those kinds of decisions with you, and allows you to tell you, because of this medication that you're taking, this type of sedation may not be the best for you. But far and away, the majority of people are able to have that done, and it's a wonderful adjunct to be able to offer to our patients so that they can get their treatment done all at once. Absolutely.
Beautiful. And obviously, no pain involved. That's just period. You don't feel the drilling and the poking and the whatever. It's just not there, right?
Well, and not only that, is the next day you don't even remember that you were here. So that's even better. So not only don't you feel it, but you don't remember it either.
Right. And you mentioned that before. You said that people kind of like, they walk up to the front office and they say, so when are we going to start dentistry? And you go, well, it's all done.
And
so let me ask you.
We've been finished for half an hour, yeah.
Right. Let me ask you, in this context, has ever anybody offered you to pay again? They paid before, and they said, all right, let me pay, and because they don't remember they paid?
That hasn't happened, but I'm sure it could have. I'm sure it's happened at one time or other, but not in our office, no.
All right.
We take care of that all up front. It's fine.
Dr. Jones, bye-bye.